Hi everyone. Welcome to another episode of the My Pocket Preceptor podcast. Tonight, I'm doing something a little bit differently, but nonetheless, on this channel, we are talking about nursing, finances, and self-care. So I would like to address the comment that a subscriber made about how to get through fundamentals. So fundamentals is one of the core classes that you'll have to take in nursing school, whether that is in an LPN program or in the baccalaureate program or the associate degree program, right? So oftentimes it's one of the core classes that students will have to take when they are matriculating through the nursing program. So it can be very jarring whenever one starts fundamentals because you're now faced with a lot of didactic information about the processes of the body, about a lot of the chronic diseases that we see in the patient population. And then also you have the clinical component along with it. So a lot of the times it's very overwhelming, not only in didactic, but in the clinical setting for students to be able to process all this information. So for the past year, I've been teaching students, particularly in fundamentals and in med-surg. So I'm able to give you some insight into how you can pass fundamentals successfully. These tips are not all inclusive, but they are ones that I've found to be beneficial for my students. So the main thing is to study. You have to study the information that is being taught in the didactic portion in correlation with that week's clinical tenets, right? So if you're learning about blood pressures, if you're learning about hypertension, it behooves you to go ahead and study the information that's being learned in the didactic portion, and the clinical is going to reinforce the skills associated with that. In my institution, we often have it where the first few weeks of clinicals, the students are learning how to take a blood pressure. They're learning vital signs. We are literally there teaching students how to calculate a respiratory rate, how to calculate a pulse rate, and how to calculate that based on if the rate is regular or irregular. So what we teach our students in accordance to the curriculum is, for example, for a heart rate, if you are checking the pulse on the radial aspect, right? If you're checking a radial pulse and you feel that the pulse is regular, then you can go ahead and count the number of beats or number of pulsations that you feel in a 15-second time frame, and then you can multiply that number by 4. Other calculations may be that you can check the pulsations over a 30-second time frame and then multiply that number by 2. However, if you notice that the pulse is irregular, and you'll notice that within the first few seconds of palpating the pulse, if the pulse is irregular, then you will have to feel or count the number of pulses for a minute, right? So for 60 seconds. It doesn't correlate if the pulse is irregular. In addition to checking the pulse for 1 minute, you also have to then listen to the apical heart rate, right? So listen to it at the apex of the heart, and also listen to it for a full minute. So these are some of the things that you have to know coming through nursing school or matriculating through a nursing program, how to calculate a pulse rate. But in addition to that, learning when you listen for an abridged amount of time and when you'll listen for the full length of time. And then also taking the next step and listening at the apical pulse, at the apical aspect at the apex of the heart, the point of maximum impulse, right? So that's some of the things that you need to know. So if you're not learning this in lecture, if you're not reading these in the books, you're not going to know to apply that when you go to the clinical setting. In addition to that, studying will help you to find out which studying type best suits you. So there are 5 different domains for which people learn, primary ones being auditory, so you learn by listening to things primarily. Another one may be visually, where you see someone do a task and then you're able to do the task as well after seeing it for 1 or 2 times, or how many times it may be for you. Also, there's tactile learning, which I think that's my primary learning, where you're actually rewriting notes and taking a lot of description from what the person is saying. Then there's also kinesthetic, where you actually have to touch the object or actually do the motion of the thing, right? And there's a fifth one that I can't recall right now. But it's important to understand that, so that when you're studying, you are being very intentional about the time that you know that you are an auditory learner. You can put on an ebook when you are cooking. You can put on an ebook when you're in the car, and then you can use that time in order to be able to use it as a study aid for you. So you're not taking additional time out of your day to study, which a lot of students find that to be very cumbersome when they have to physically sit down and study. So if you learn that you can incorporate this into your everyday life, then it's going to be much more effective for you for your studying. And then also, as I stated before, if you know your learning styles, you know what you need, what steps you need to do. I am a tactile learner primarily, so I will print out PowerPoints, and then I'll also read and make notes for myself. When I was going through nursing school, I always had a whole bunch of flashcards that I had written out for myself based on the PowerPoints and on the notes, and that's how the information was able to stick in my head. So you have to learn your own learning style, and that really comes from practice and actually studying. The second way is to study in groups. There have been scientific research that has been done that shows the power of collaborative learning and learning in groups. You're able to learn from each other, and it just reinforces a lot of the learning skills that goes missed whenever it's just learning by yourself isolated. Similarly to how you will be working collaboratively in the clinical settings, whether that be outpatient, inpatient, in surgery, right? As nurses, you have to work collaboratively with other people. So it's better to just start reinforcing this early into your nursing education and have it be to your benefit. The other thing is to actually do it, right? In clinicals, you need to actually be doing the skills that's being reinforced in the didactic. A lot of the students I've found often have issues with the vital signs, and that may seem really simple, but they may often have trouble calculating a blood pressure. And so if this is a skill that you are learning for the very first time in fundamentals, it is going to seem overwhelming, right? So we all know that the first heart sound that we hear when we're checking a manual blood pressure is associated with the systolic blood pressure. And then we're taught that the last heart sound that we hear, or that thud, is associated with the diastolic blood pressure numeric value. But what I've noticed is that a lot of students do not clearly hear the last heartbeat, right? They don't clearly hear that diastolic blood pressure that then gives them the number that they need to write down for their blood pressure. And some people have actually made that number up. And I don't advise that as a practice. Don't ever make a blood pressure up. Don't just, give a number just because you think that's what it should be, right? We're taught that the blood pressure should be 120/80. So with that knowledge, don't just think, okay, I really heard the systolic at 140, but I don't know what I heard for the diastolic, so I'm just going to say 78, or I'm just going to say 76. So you could be within the normal range for blood pressure. Don't ever do that. So that is why I advise you to practice on your fellow classmates, to practice on your family members, and really practice on healthy individuals so you can find out your sequence. You can find out where it is that you're going wrong and really pinpoint those areas that need additional information and additional areas of practice. If you tell me student that the blood pressure is 118/69, I automatically know that you're making that number up, because there's no way that that numeric value could be an odd number. Okay, the calculating numerical sequence on there is in even numbers. It doesn't give odd numbers. So it goes 80, 78, 76, 75, 74, 72, 70. So if you tell me an odd number, I automatically know that you're not telling the truth about that blood pressure. So don't embarrass yourself that way. But most importantly, don't put the patient at risk. So practice, practice, practice. Practice on your significant others, practice on your children, practice on your spouse, practice on everyone that will allow you. And I encourage you to practice at least 2 times a week, right? Even if it's after dinner or something really simple, you may have to do a focused assessment where today you're just focusing on neuro, and tomorrow you're focusing on cardiovascular, and you're not doing necessarily a whole head to toe assessment in one go, because that might take a while because you are still learning. So practice, practice, practice. I cannot implore you enough to learn your study styles, study in a group, and then practice. With that, those are the recommendations that I know have gotten my students through fundamentals. Even though they thought they weren't going to make it, they actually did. So if you have any other tips and tricks for this particular subscriber, I encourage you guys to leave it in the comments. And once again, thank you for your time and your attention. Please like, subscribe, and share this to anyone who you think would find value. Thanks again. Have a good night.